Next topic, COVID divide and conquer programs. It started. Roughly 2/3 of Americans say they wear masks in public. Or is it 85%? Unfortunately, that leaves, it says, a substantial portion of potential COVID-19 carriers unmasked. And coming across anyone flouting public health recommendations and putting you, your family, and your community at risk triggers a number of thoughts and feelings, according to this report. And depending on the situation, your annoyance could range from a mild simmer to an all-out rolling boil. So what do you do? So what they're trying to do is to get the public to kick off on each other. First off, your indignation at that Target shopper in front of you in line without so much as a handkerchief around their neck is warranted. Wearing a mask is crucial. The medical community, including the White House health advisor Anthony Fauci, has said in many ways as possible that Americans who aren't wearing face masks are increasing the risk of spreading the virus. But if people are wearing masks, how is it spreading it? Oh, stop it. I'm talking common sense again. Right. Even symptomatic carriers of the virus may be spreading the disease, it says, and it's absolutely reckless to expose the elderly, the ones where they sent the sick to the elderly places where they all died. So now they're suddenly interested in the elderly and other at-risk groups to airborne coronavirus. And the reason for social distancing and wearing face masks in the first place. And this is what they're doing. Divide and conquer. Here's another example. As coronavirus cases in the United States, it says, surpass 4 million, travel nurses who help treat patients in hospitals across the country are noticing a troubling trend in their home states, whereby friends and family who doubt the seriousness of the virus or even believe conspiracy theories about it. Oh dear, these people. We had to wake up with fear and go to bed with fear, said Alumide Peter Collade, who is a nurse who spent over 3 months treating patients in New York. Colleagues were getting sick. It was like a war zone. It was very traumatic. And Collade, who was born in Nigeria and grew up in California and Texas, was living in Los Angeles at the beginning of March when he couldn't escape the frightening news reports of overwhelmed hospitals in New York City. I packed my bag, didn't think about it twice, he said, only to get there and find that all the hospitals were empty, as we had on-the-ground proof of. So Collade's 21-day contract in New York City turned into a 104-day stay, and now he fears for his home state of Texas as cases continue to increase. A few of my friends that I talk to in Texas would try to tell me, oh no, this is a virus-driven agenda. This is a plandemic, not a pandemic. Collade tells Yahoo Life. It just felt like it was an insult to anybody that's putting their life at risk just to provide care for anybody out there at the hospital. Where did he get these people from? Just because their narrative is no longer working, out comes the divide and conquer tactics of guilt and shaming. And what they're doing is they're getting the people to turn nasty on each other. That's what these two reports are about. That you should get angry and should take off on these people. They're risking your life. No, actually the ones with the masks are risking their life, as time will tell. What they're doing is getting people to turn nasty on each other, and that becomes a total distraction to their, quite frankly, ridiculous policies, banal excuses, and devastated economy, and then blame it all on the people for not wearing masks. As for Mr. Kool-Aid, or is it Kool-Aid, please shut your pie hole. The people do not need to hear your stories based on agendas, you know. But isn't it funny they'll allow this shit to be peddled and yet ignore the plethora of other doctors and nurses calling this pandemic as fake? But what they have also set out to do is a reverse psychology program here of making out that nurses and doctors are heroes. But if they were such heroes as the mainstream media portrays, why are most of them so poorly paid? Oops. I have to be careful again. I'm talking too much common sense again. So what is behind all this medical heroes rhetoric? Well, what it is, it's another setup program for the future. So you won't question the heroes when they roll out the vaccine. And the new heroes will be told to administer them. Are you seeing the picture now? And the great question is, what about the brave hero doctors and nurses who have come out and said that this is all BS, only to be blocked and deleted off the internet by fascists? What a way to treat heroes that is. And what is happening is the doctors and nurses are being set up like the Black Lives Matter people. The system will turn on both of them over time, just as I had warned. Here is a real man of honour and a real hero who unleashed a storm this past week. The Japanese professor of physiology or medicine, Professor Dr. Tasuku Honjo, who caused a sensation in the media by saying that the coronavirus is not natural. He said, if it is natural, it will not have affected the whole world like that. Because dependent on the nature, the temperature is different in different countries. If it were natural, it would only have affected the countries with the same temperature as China. Instead, it spreads to countries like Switzerland the same way it spreads to desert areas. Whereas if it is natural, it would have spread in cold places, but it would have died in hot places. And he said, I've done 40 years of research on animals and viruses, and this is not natural. It is manufactured, and the virus is completely artificial. And he then said, I've been working for 4 years in the Wuhan laboratory in China, and said, I know all the staff of this laboratory well. I called them all after the corona accident, but all of their phones have been dead now for 3 months. It is now understood that all of these laboratory technicians are dead. And he said, based on all of my knowledge and research to date, I can say this with 100% confidence that corona is not natural. It did not come from bats. China made it. And if what I say today turns out to be false now, or even after I die, the government can withdraw my Nobel Prize. But China is lying, and this truth will one day be revealed to all. Dr. Tasuku Honjo.